Well, welcome everybody. People are coming into the webinar. Thank you for joining us for our March Eggheads webinar. We will give it just a minute to allow more folks to join. So thanks again, and we'll be right back. Once again, if you just are joining us, welcome to our March Eggheads webinar. We've got a great presentation, two presentations ahead. We're just going to give it a minute for people to join, and we will be right back. Okay. Well, I think we'll go ahead and get started. We want to be respectful of everybody's time, and we know that this is bright and early for a lot of folks. So thank you again for joining us for our Eggheads webinar. My name is Jeff Bontrager. I'm Director of Research and Evaluation at the Colorado Health Institute, and I also lead with my colleague Christy Ariano our Colorado Health Access Survey efforts every other year. And I'll tell you a little bit more about the Colorado Health Access Survey, or the CHAS, in a bit. But before we do that, I just wanted to acknowledge that there has been a lot that has happened in the last 24 hours with school violence. And this seems to be happening all too often. And we certainly are thinking about the East High School community here in Denver, as well as all communities that are affected by gun violence. That being said, we are glad that you are here today, and we've got a great set of two presentations ahead. These two topics are really linked together by the fact that they represent necessities that can pose real affordability challenges for households in Colorado. And those are childcare and prescription drugs. And a few housekeeping items before we get started. We are interested in who else is on the webinar, so please put your name and affiliation in the chat, and it defaults to send it to just the speakers and panelists. So if you would just change it so to everybody, so that all participants can see who is also participating today in Eggheads. And then the second thing is that the slides and a recording of today's webinar will be made available afterwards on the Eggheads section of CHI's website. So that will be available, and we will also be including some links throughout the webinar to our analyses of the childcare and prescription drug affordability from the CHAS. Next slide, please. So in case you're not familiar with the Colorado Health Institute, we are a nonprofit and mission-driven consulting and research group that really is working to advance health equity in Colorado through deep analysis and implementational know-how. I think today is a great example of that, where we're doing a deeper dive into some of these topics that really affect household budgets. And I will introduce my colleagues, or they will introduce themselves, Rachel Boyer and Emily Santich, here as we get into their analyses that I think you'll find really interesting. Next slide. So in terms of the agenda for today, I'm going to give just a brief background and overview of the Colorado Health Access Survey. I know that many of you are familiar with it, but just in case there are some that are not as familiar with it, I'll talk about that. And then I will be turning it over to my colleague, Emily Santich, to talk about childcare access in Colorado and what we found from the survey. Then we will turn it over to our colleague Rachel Boyer, who will talk about prescription drug affordability and how Coloradans report on prescription drugs in the state. And then we have kept plenty of time for questions and discussion at the end of the webinar. If you have quick clarifying questions, feel free to put those into the chat or the Q&A feature here on Zoom. Otherwise, jot down your questions and we'll be sure to get to them during the discussion time at the very end. So just real briefly, what is the Colorado Health Access Survey, which we affectionately refer to as the CHAZ? It is a large-scale population-based survey of 10,000 Colorado households that CHI administers every other year. The data that you'll be hearing about today are actually from the 2021 survey, but we're really excited that just this week, the 2023 Colorado Health Access Survey is now in the field. So it's possible that some of you attending this webinar may get an invitation in the mail to actually fill out the survey, and we would certainly encourage you to do that. So we will be fielding the 2023 questionnaire, the survey this spring, and the data will be available later this year. Just real briefly, the survey is done through the invitation for the survey is sent to a random sample of Colorado addresses, and then people have the option either in English or Spanish to complete the survey online or through a toll-free number. And the survey includes a wide variety of topics, including access to care, health insurance, the use of care, affordability, health status, behavioral health. But we're really excited that in the 2023 survey, we have a number of brand new topics that we are introducing to the survey that we're looking forward to getting deep information about, including long COVID and the economic impacts of long COVID, reproductive health, climate change and health, digital literacy and access to broadband, among many others. So stay tuned for more information about the 2023 survey. And of course, we need to acknowledge those entities that make it all possible. The Colorado Health Foundation has been our anchor funder for the Colorado Health Access Survey. And then for the 2021 survey, we had a number of additional sponsors, including state agencies and other foundations. So we very much appreciate the support of the CHAZ, because without this support, the Colorado Health Access Survey would not happen. So with that, I am really pleased to hand it off to my colleague, Emily Santich, who is going to go over her analysis of childcare, and then she'll hand it off to Rachel, who will talk about analysis of prescription drug affordability. So Emily, take it away.
Awesome. Thanks so much, Jeff. Good morning, everyone, and thanks again for joining us. I'm Emily Santich. I'm a policy analyst here at CHI. And since joining, I've been involved in a lot of our team's assessment work and research in the early childhood and maternal child health space. So today I'm going to share a little bit about the current state of childcare access in Colorado and some of the ways that stakeholders across the state are working to improve the childcare system. And childcare access is top of mind for a lot of people, both nationwide and here in Colorado. You may have heard President Biden mention affordable childcare in this year's State of the Union address, and childcare and pre-K have been cornerstones of his economic policy agenda. And here in Colorado, Governor Polis has made universal preschool a key priority since taking office. And last year, the Office of Early Childhood was elevated to the Department of Early Childhood, signifying its increased importance. So access to quality, affordable childcare is top of mind. It's been in the news and it's a priority. But why are we talking about it during a health policy webinar series? Well, there are a few reasons that are informed by the CHAZ and other research. Access to childcare is a social determinant of health, which are factors that influence health outcomes. Things like food, housing security, education, and the built environment all shape the conditions in which we live, work, and play. And access to childcare is among the social determinants of health. This is evidenced by the fact that according to the 2021 CHAS, parents and guardians who reported unmet childcare needs were more likely to report experiencing housing instability, food insecurity, and problems paying medical bills. Those who have trouble accessing childcare also report worse mental and physical health. This correlation suggests that the same underlying social and economic factors that make accessing childcare difficult also affect an individual's ability to thrive. The unaffordable cost of childcare means that many families with young children must decide if they're going to spend a significant amount of their income on childcare, find less expensive but potentially lower quality childcare, or leave the workforce altogether to care for their children. The high cost burden drives more women than men from the workforce and disproportionately impacts women of color, women without a college degree, and women living in low-income earning households. And finally, not having access to childcare can actually be a barrier to parents and guardians making it to their own medical appointments. So before I dive into the CHAS data, there are a few highlights to take away from today's presentation. Difficulty accessing childcare is common, and it affects some Coloradans more than others by geography, race, ethnicity, and income. And when families struggle to afford childcare, they can miss out on parts of life that help them thrive, such as affording healthy food, safe and stable housing, fun activities, family trips, and saving for the future. And there is great momentum and important work happening in this space, but more is needed to make childcare accessible to and affordable for all families across Colorado. All right, moving on to the Colorado Health Access Survey and what we found. So since 2013, the CHAS has asked, in the past 12 months, were you unable to schedule a healthcare appointment because you couldn't find childcare? And in 2021, 2 additional childcare questions were added, which were, in the past 12 months, was there a time when you could not find childcare when you needed it for a week or longer? And what is the main reason you were unable to get childcare at that time? So on the next few slides, I'll share with you some of our analysis and what we found from these questions on the CHAS. So one of the things we found is that nearly 1 in 10 parents or guardians reported there was at least a week in the past 12 months when they needed but could not get childcare. And this accounts for about 200,000 Coloradans statewide. And we know that this is even more challenging for families with young kids. We also found that the most commonly reported reason was cost. Nearly a third of those who said they couldn't access childcare reported that it was due to affordability. Not having access to childcare disproportionately impacts low-income earning Coloradans. Low-income earning parents and guardians were nearly 3 times more likely to report that they were unable to access childcare compared with high-income earning parents or guardians. And this disparity would likely be even greater without programs like the Child Care Assistance Program, which provides financial assistance to low-income earning families for childcare expenses. If you look at the middle statistic, you'll see that COVID-19 was also a barrier. Throughout the pandemic, childcare centers have been closed or they've struggled to stay open due to outbreaks. And the third most commonly reported reason was other. So after these top 3 reasons, respondents also noted barriers related to provider availability, quality, and location. But it's notable that some other reason was in the top 3 reasons. So for folks that are on the call today, I would love to hear from you. What are some of the barriers that you or people in your networks have experienced as it relates to accessing childcare? And you can use the chat to share those with us. So affordability is a barrier and childcare is costly. In a moment, I'm going to pull up a trivia question that you can respond to in real time, which is, what is the average annual cost of childcare in Colorado for 1 child? So I'm going to go ahead and launch that. And you should see it pop up on your screen. And I see that some folks are already responding. So let us know how expensive you think the annual cost for childcare is on average for one child. Go ahead and take the next 30 seconds or so to cast your vote, and then we'll show the results. All right, we're getting some good responses in, so I'm going to go ahead and share the results of the poll. And a lot of folks guess that it's between 10 and 15,000 or over 15,000. So that is right on the mark. And I'm sure for a lot of people, this is more than a guess, but a reality. So thank you for sharing in our trivia this morning. And I am going to go ahead and close that out. You might have to exit out on your screen as well. But for those that guessed in that range, you're absolutely correct. The average annual infant care cost in Colorado is around $15,000 a year, which is about 21% of the median family income in Colorado. And the average annual childcare cost is around $12,000 in Colorado. So how does this compare to other expenses? Well, this is looking at a Colorado family with 2 working adults and 2 children. And in that scenario, childcare is the biggest expense. This is more expensive than housing, transportation, food, and medical expenses. And it's truly a challenge for everyone involved. It's difficult for parents and guardians, businesses, and caregivers alike. It's hard to operate a childcare facility given high personnel costs associated with meeting child-staff ratios. It's expensive for families to get in, if they can get in, given that there are often long wait lists, and providers typically make close to minimum wage. And challenges accessing childcare vary across the state. This map shows the percentage reporting they could not access childcare when they needed it for at least a week by health statistics region. And parents and guardians living in Pueblo County or rural Southwest Colorado were more likely to report that they couldn't access childcare when they needed it. These areas are in the darkest blue on the map. And this is also in line with findings from the 2019 Colorado Shines Brighter Needs Assessment conducted by the Colorado Health Institute, which found that parents in Pueblo were less likely to have access to their preferred type of care compared to those living in other urban counties. These areas also experience a higher childcare cost burden, meaning that the percent of the median household income that's needed to pay for childcare is higher. So that could be one of the reasons explaining why we see this difference. Access challenges also vary by race ethnicity. This figure shows the percentage reporting they could not access childcare when they needed it by race ethnicity. And nearly 1 in 5 Black or African-American parents or guardians reported they couldn't access childcare when they needed it, compared to about 1 in 10 Hispanic or Latino and about 7% of white parents or guardians. This figure dives a little bit deeper and shows the 2 most commonly reported barriers by ethnicity. And we see that over half of Hispanic or Latino parents with unmet childcare needs cited cost as the top reason, compared to about 20% of non-Hispanic white Coloradans. And these findings are important when we think about the childcare needs that families have. Certainly everyone would benefit from more affordable childcare, but policies and interventions that are going to change the landscape will take these barriers, potential parental preferences, and access to resources into account. Childcare is also a barrier to parents and guardians accessing medical care of their own. This figure shows the percentage who reported they were unable to schedule a medical appointment because they couldn't find childcare from the 2015 CHAS to the 2021 CHAS. And childcare as a barrier to medical care was on the rise, but during the pandemic, we saw a decrease. This is probably because of the rise in telehealth. People didn't need to find childcare to make an appointment. But it's notable that even with this decrease, this still represents over 100,000 parents and guardians statewide. So I'll be interested to see how or if this changes in the 2023 CHAS. And while this took a downturn in 2021, female and Hispanic or Latino parents were 3 times as likely to report not scheduling an appointment due to unmet childcare needs as male and white parents. And low-income earning parents or guardians were 4 times as likely to report childcare as a barrier to medical care compared to high-income earning parents or guardians. So while we did see this decrease in 2021 overall, there are significant disparities and for whom childcare is the greatest barrier to accessing medical care. And I've mentioned that those who had trouble accessing childcare also reported worse mental and physical health, but this figure really demonstrates that disparity. The light blue bar here represents those who could not access childcare, and the dark blue bar represents those who could. Poor mental health is on the left and poor general health is on the right. And when looking at both of these, we see that those who reported difficulty accessing childcare were about twice as likely to also report poor mental and physical health. So we see an association between childcare access and health, which is not to say that one necessarily causes the other, but this goes back to thinking about childcare as a social determinant of health. It emphasizes the need for holistic supports for families from economic to social to health needs. And I want to shift gears a little bit and talk about what's being done to improve the childcare system, starting with a policy spotlight of the Department of Early Childhood and Universal Preschool Program. So the Department of Early Childhood was established in July 2022, and they ensure the delivery of a comprehensive, community-informed, data-driven, high-quality, and equitable early childhood system that supports Colorado's young children, their families, and early childhood professionals in all settings. And Universal Preschool was created under House Bill 22-1295 and launched by the Department of Early Childhood to begin in the 23-24 school year. It ensures that every child in the year before they're eligible for kindergarten is eligible for up to half day, 15 hours of state-funded voluntary preschool. And there's a lot of great work coming out of this department in addition to Universal Preschool, including millions of dollars in community innovation and resilience for care and learning equity or CIRCLE grants that make high quality childcare more accessible and more affordable. And here are some other recent examples of policy solutions in this space. The Child Care Contribution Tax Credit enables childcare providers to receive financial donations directly from individuals and businesses, and those individuals and businesses can claim a 50% state income tax credit for qualified contributions for childcare providers. And this funding stream brings in about $60 million every year to childcare providers across the state. So this bill, which was introduced this session, would reauthorize the Child Care Contribution Tax Credit for an additional 3 years. Senate Bill 22-213 and Senate Bill 21-236 have both increased the capacity of the early childhood system through additional program funding and training to support the early childhood workforce. House Bill 22-1010 created a refundable income tax credit for early childhood educators earning below a certain income level, effectively putting more money in the pockets of early childhood educators who are typically employed in close to minimum wage jobs. And House Bill 22-1006 reduces the cost to operate a childcare center through property tax exemption. So these are just a few examples of recent policy solutions, but if we have folks joining today that are tracking on these bills, let us know in the chat if there's some that we missed that you'd like to highlight. So outside of legislation, there are also programs, partnerships, and coalitions advancing and improving the childcare system. The Colorado Child Care Assistance Program provides financial assistance to low-income earning families for childcare expenses. Colorado Shines is the state's quality rating and improvement system for childcare programs, and it provides resources to families and helps them find quality childcare. Executives Partnering to Invest in Children, or EPIC, is a group of business executives that support early childhood initiatives, promotes family-friendly work environments, and aims to increase access to childcare and early education. The Colorado Children's Campaign and the Colorado Statewide Parent Coalition lead the Growing Our Future Coalition, which aims to reform state tax code to generate more money for childcare and other types of caregiving. And we know there are many others. There are a lot of really dedicated partners working in the early childhood space, such as Early Milestones Colorado, Healthy Childcare Colorado, Colorado Head Start Association, and many more. So if you're joining us today and you represent one of these organizations, please let us know in the chat. And there has been great progress, but more work is needed. Public and private sectors have a role to play in improving childcare accessibility. And additional funding, partnerships, and policy change are really needed to improve the system for families, childcare providers, and childcare facilities. All right, so I will pause here for any clarifying questions on the information that I've just shared. I'll ask that you hold on to any discussion questions as we'll have time for Q&A after Rachel's presentation. But happy to pause here and see if folks have any questions about the data or any of the findings that I've shared. All right. Well, hold on to your questions. We'll have time for Q&A at the end. But with that, I'm going to pass it over to my colleague, Rachel Boyer.
Okay, thanks so much, Emily. Let me get my screen going here. Okay, so thank you, Emily, for presenting that information. And thank you, everyone, for participating in the chat. I really was kind of soaking in all the information that people were putting in the chat about the barriers they faced with childcare. And I really appreciate everyone sharing their perspective. I am going to go ahead and pivot us to another topic that has to do with affordability and healthcare. And we'll see shortly that there are issues in our state with affordability and prescription drugs. So let's frame the problem a bit first. So why are we talking about prescription drugs? Well, they are a big focus of affordability improvement efforts right now. Both the Biden administration at the federal level and the Polis administration at the state level have made drug affordability efforts a priority. And nationally, there's also this feeling that this current drug spending situation is untenable. So to demonstrate the extent to which drug spending in the United States has grown, I'd like to ask for your participation in a little bit of trivia. So I'm going to launch a poll here. Okay, so this is a little bit of trivia question. We know that the US spends more on prescription drugs than any other nation, but let's see if our audience can guess how much that is. So the question is, US spending on prescription drugs accounts for how much of total global spending on prescription drugs? And as you're answering, for context, the US population is only about 4.2% of our total global population. Okay, I'll give it a few more seconds for everyone to get their guesses in. Okay, let's end the poll and share the results. Okay, great. So actually our audience was able to guess the right answer. The right answer is that the US spends about, accounts for about 40% of the total global drug spending, which is clearly disproportionately high compared to our slice of the world's population. So clearly there's some kind of large systemic issue at play in our country. Okay, I'm going to stop sharing, and you might have to X out of this poll to see the slide deck. Okay, so I think we all know that there are large issues at play at the national level with regards to total global drug spending, but what does this issue look like in Colorado specifically, and how is it impacting the health of Coloradans? Well, luckily the CHAZ can help us get a good picture of what affordability looks like for Coloradans. So in this next section, I'll walk us through the data we collected on the CHAZ about prescription drug affordability. Some key takeaways right away are that first, almost half of all Coloradans take at least one prescription medication. So this indicates that issues in this area are going to have widespread effects on our population. And secondly, about 10% of Coloradans were unable to fill a prescription due to cost in the past year. And that certainly has implications for health. Once we finish talking about the CHAS data, I'll also talk about some of the major policies that are being implemented in Colorado and nationally to address the issue of affordability. Okay, so let's dive into the CHAS data. First, let's talk about prescription drug use prevalence in Colorado. So as I mentioned on the previous slide, many Coloradans rely on prescription medications, and this is really no surprise. They are an essential part of healthcare. If we compare prescription drug usage of adults in Colorado to the national rate, we see a slightly lower but comparable number, where Coloradan adults take prescription drugs at a rate of roughly 57% compared to 62% for the whole nation. Here at CHI, we also analyzed prescription drug use among different demographic groups, and we found a couple of trends. First, and unsurprisingly, use increases with age. As people grow older, they're more likely to develop chronic health conditions that need to be managed with medication. This bar chart shows the percent of people who use prescription drugs by age group, and you can see that there's a clear increase as age increases. Secondly, we found that women are more likely than men to take prescription medications. Women take prescription medications at a rate of about 53%, whereas men is about 41% in Colorado. And several factors could contribute to this difference, including high rates of prescription contraception use among women and higher rates of certain chronic diseases such as osteoarthritis. And additionally, women are more likely to visit a primary care doctor than men, which may increase their likelihood of being prescribed a medication. Using the CHAS data, we also found that insurance status plays a key role in access to prescription medication. On this graph, you can see the prescription drug use and how it varies by different types of insurance coverage, compared to the pink line, which is the state average of 47%, and that's for all ages. If you look at the uninsured category, only about 20% of uninsured Coloradans report taking a prescription medication, which is well below the state average. And we know that uninsured people are more likely to struggle with accessing all types of care, from primary care to dental services, and that includes prescription drugs here. And on the other hand, Medicare recipients report the highest rate of prescription drug use at about 89%. And of course, we know that the Medicare population is typically older, so this kind of tracks. The CHAS also collected data on self-reported mental health or self-reported health status in 3 categories: general health, oral health, and mental health. And this bar chart shows the percent of prescription drug users that reported poor health in these 3 categories. If we compare that to people who do not take prescription medication, the data show that prescription drug users in Colorado are more than 3 times as likely to report poor general health and are more likely to report poor oral health and poor mental health. And this association between prescription drugs and worse health status makes sense, as prescription medication is commonly used to treat a variety of illnesses, from physical to mental. And oftentimes, prescription drugs are used to manage chronic illnesses, such as heart disease or arthritis. So this means that many prescription drug users face complex or long-term health challenges. And I'm highlighting these results today simply to demonstrate that there's a clear connection between prescription drug use and these various health measures. Therefore, access and affordability of prescription drugs is absolutely crucial. So let's talk about affordability. The CHAS shows that of Colorado adults who take prescription drugs, about 13%, or roughly 304,000 Coloradans, say they have a somewhat difficult or very difficult time affording their medication. In comparison, nationally, about 24% of adults who use prescription drugs report difficulty affording their medication. And this is a really interesting difference that we found when we were analyzing the CHAS data. I know there's a lot of expertise on the line here, so I'd welcome anyone on the line to put in the chat or put kind of their thoughts on why this difference might be so large. One factor that we've thought of is that Colorado expanded Medicaid in 2014, which resulted in affordability improvements for low-income Coloradans. And studies have shown that states that expanded Medicaid saw larger declines in uninsured rates among prescription drug users and significant cost savings for those who gained coverage. And to date, 39 states and Washington, D.C. have expanded Medicaid, whereas 11 states have not. So we're thinking that this could potentially contribute to this difference we see between the national and Colorado number. We also found that insurance status is a key difference in the ability for people to afford their medication. Nearly half of uninsured Coloradans who take prescription drugs report difficulty affording their medication. But having insurance doesn't guarantee ease of affording prescription drugs either. Roughly 1 in 5 Coloradans who take prescription medication and have insurance coverage through the individual market say they have a difficult time affording medication. There's a similar number for Coloradans on Medicaid or CHIP. However, unlike other health plans, Medicaid does have relatively low co-payments for prescription medications that are capped at about $3 per refill, with some members qualifying for 0 co-payments, including children and pregnant women. But since Medicaid and CHIP members tend to have low incomes, even the presence of a relatively small co-payment may represent a real barrier. This session, the Department of Healthcare Policy and Financing has actually proposed eliminating copays for many services, including outpatient pharmacy services, in the next fiscal year budget. So we may actually see these Medicaid copayments go away. And lastly, if we look at our final 2 insurance categories, we have employer-sponsored insurance and Medicare, with Medicare having the easiest time affording their medications at only about 6% of people reporting difficulty affording medications. So with these high prescription drug prices and other affordability challenges, many Coloradans are forced to choose between their medications and other expenses, such as food, housing, essential things. And we found that 9.7% of Coloradans report not filling a prescription drug due to cost in the past year, which is over 540,000 people. And that's more people than live in Colorado Springs. Of those who said they were unable to fill prescription drugs due to cost, about 40% indicated that their health condition got worse as a result of foregoing the medication. And these figures have stayed consistent over the past 6 years, which demonstrates a systemic issue with prescription drug affordability amid rapidly rising drug prices and other consumer cost pressures. Okay, so what about the policy side? What is being done to address this issue? Well, I'd like to highlight a few policies at the federal and state level. So first of all, at the federal level, last year, the Inflation Reduction Act was passed in August, and it broke a long streak of policy inaction on prescription drugs at the federal level. It includes several provisions that are going to lower prescription drug costs for Medicare enrollees specifically. Most significantly, the Medicare program is going to be able to directly negotiate the price of high-cost drugs. And these price negotiations will be reflected in lower prices for patients starting in 2026. In the meantime, drug companies are going to have to pay Medicare rebates for raising drug prices faster than inflation. And there are a few other cost-saving measures listed here that will cap out-of-pocket spending for Medicare members. It's estimated that over 113,000 Medicare members in Colorado stand to benefit from the various cost-saving and benefit eligibility expansion measures in this bill. So it's going to benefit a lot of Coloradans who are on Medicare. On the state side, I'd like to highlight the Colorado Prescription Drug Affordability Board, which is also known as the PDAB. The PDAB is an independent, nonpartisan entity in the Division of Insurance in the state government that is tasked with reducing state spending on high-cost and high-use drugs. And several other states, including Maine, Maryland, New Hampshire, Ohio, and Oregon, have also recently established PDABs. But one thing to note is that in comparison to these other PDABs, our PDAB has a relatively broad scope and is moving quite swiftly. In Colorado, the PDAB actually has the authority to establish upper payment limits on drugs that are deemed unaffordable. And these upper payment limits are going to limit purchase and reimbursement amounts for drugs, which should ultimately translate to a lower out-of-pocket cost for patients overall. And to determine which drugs qualify for these upper payment limits, the PDAB is going to conduct extensive affordability reviews of certain prescription medications that incorporate information from many stakeholders, such as manufacturers, insurance carriers, and patients. And the PDAB staff recently shared their anticipated timeline. They are expecting that the PDAB will conduct affordability reviews this year and decide on upper payment limits towards the end of the year. And these upper payment limits will then go into effect in the Colorado market sometime in the middle of next year. And there's also additional legislation that has just been introduced to kind of update certain rules surrounding the PDAB, including removing the limit on the number of upper payment limits that can be established for the first couple of years of the PDAB. And the impact of the PDAB is going to depend largely on which drugs are selected for upper payment limits. So it's difficult right now to predict an exact number for cost savings. However, for some Coloradans who rely on really expensive drugs, the impacts of this policy could be transformative. There are a few other policies happening in Colorado that I just want to touch on. And really all these efforts combined have made Colorado a leader in prescription drug affordability efforts among states. In 2019, Colorado became the first state in the nation to pass a bill capping the monthly price of insulin for people with insurance. And in 2021, this program was expanded to include all people with diabetes, regardless of insurance. Another bill in 2019 established the Canadian Prescription Drug Importation Program in the Department of Healthcare Policy and Financing, which seeks to establish a framework to import low-cost prescriptions from Canada once the federal government allows it. And another bill in 2021 was passed to include other countries besides Canada in this program as well. And in both 2021 and 2022, the legislature passed bills to constrain how pharmacy benefit managers operate with the goal of improving affordability for patients. There's also a few bills under consideration right now during the legislative session. The first is aimed at reducing the cost of epinephrine auto-injectors, which are colloquially known as EpiPens. So regardless of insurance status, Coloradans who enroll in this program would be able to buy a 2-pack of EpiPens for no more than $60. Right now, without insurance, that 2-pack could range anywhere from $350 to $700. There's also a bill regarding a spread pricing ban. And this would basically prohibit pharmacy benefit managers from charging insurance carriers more than what they paid the manufacturers for a drug. So it essentially eliminates a source of price inflation in the drug supply system and a revenue stream for pharmacy benefit managers. And this is just a brief touch on these policy efforts in the state. There are additional policy efforts underway that we don't have time to touch on, but are also important. Okay, so we just reviewed the data on the CHAZ about prescription drugs and also some policy initiatives going on in the state. But we also know that there's likely more work to come in this area. So I'd like to ask for your participation in another Zoom poll. And this one is less trivia, more just opinion. And the question is, what do you think should be a focus of future prescription drug affordability efforts in the state? And while these all may be important, I've limited it to just one choice. So go ahead and look over this poll and cast your vote for what you think the state should focus on in the coming years. And while our audience is considering this poll, I'd like to thank staff at the Division of Insurance and the Department of Healthcare Policy and Financing for their thought partnership as we were reviewing and analyzing CHAD's data. I'd also like to put in a brief plug-in for our next Eggheads webinar next month, which is Solutions to Strengthen Colorado's Youth Mental Health Ecosystem. And that is going to be April 20th at 8 a.m. So book that on your calendars as well. All right, well, I will keep this poll running for a little bit while people kind of read through and consider the policy options. But other than that, we can go ahead and open up the discussion question. My colleague, Ali Morgan, is going to be helping us kind of field questions. But at this time, we are open to your questions for either my presentation or Emily's presentation, and we're excited to hear what you have to say. Thanks.
Thanks, Rachel. Thanks, Emily. And good morning, everyone. It's great to see some familiar names on the webinar today. And I also have appreciated some of the comments and questions that came in through the chat during our presentations. But we've got 10 or 15 minutes now for an open discussion portion. And so would really like to hear what this makes you all think about. Are there other questions for discussion? Are there just sort of insights or feedback that you might have after listening to Emily and Rachel talk? We're happy to take additional questions or comments either in the chat, or you can use the Q&A function at the bottom where you can kind of submit questions one at a time and we can select them to answer. So while everyone is processing, because I realize that was quite a bit of information over the last 45 minutes, I can go ahead and kick us off with some questions because Emily and Rachel, I wrote some in case everyone needed a little bit of time to digest. So we'll just go ahead and get started, but I will monitor the chat and the Q&A from our attendees. So Emily, I'm going to start with you since it's been a few minutes since you have graced us with your voice and your presence on screen. I wanted to go back to the map that you showed about Coloradans who said that they struggled to afford accessing childcare when they needed it. A note of thanks to our colleague Jeff Bontrager for answering the good question that Amanda Kim asked in the chat about why some of the data weren't reportable by county. So thanks, Amanda, for that clarifying question when you talked about the map. But Emily, what are some of the reasons for differences that we see across the state? Like, do you have a sense of why this varies so much based on where folks live in Colorado?
Yeah, thanks, Ali, for the question. I think part of it definitely has to do with the cost burden of childcare. So when you look at how expensive childcare is in a particular area and how that relates to the median household income, it can just be more difficult for folks to afford childcare depending on where they live. And childcare prices vary across the state. So affordability is definitely one factor. Availability is another factor. I think what we found through the Shines assessment in 2019 is that a lot of parents would prefer a more formal type of childcare, such as bringing their child to a more formal childcare facility. But there just aren't enough spots for all of the parents and guardians who would like to put their children in that type of facility. And I know that we saw some chats from folks that are attending today that have experienced something similar. So I think those are two factors that definitely influence this. And I'm sure there are others as well. So I welcome other folks to share in the chat with us or come off mute if you have an experience that you'd like to share that might speak to this a little bit better as well.
Great. Thanks, Emily. And yes, I was one of the people who chimed in the chat because my family has experienced this recently, as you know, and it sounds like, unfortunately, we are not alone just among folks on this call. Well, while we're waiting to see if there's anybody who'd like to sort of respond to Emily's call for other thoughts or anything personal in terms of your experience with this, Rachel, I'm going to sort of pivot it back to you and ask a question specifically about policy. So there is so much, as you pointed out, that's been happening, is currently happening in the prescription drug affordability space at the federal and state level. I know you gave us a good snapshot of what's happening, but you also mentioned that you didn't have time to cover all of these policy initiatives that are either recent or maybe even happening as we speak. And so I just wondered if there was anything else that you'd like to sort of name or highlight now that we have a few extra minutes.
Yeah, thanks for that question, Ellie. I think one other really interesting effort that is happening in this area is that HCPF, the Department of Healthcare Policy and Financing, has developed a prescriber tool. And this tool does a couple of different things, but one thing it allows prescribers to do is actually look up people on Medicaid benefit information and actually see if they prescribe a medication, how much is that going to cost the Medicaid member? And so it really allows prescribers to have a little bit of flexibility and a little bit of information when they're prescribing about the affordability of a certain drug. So it's not so much of a mystery, you know, when a prescriber prescribes a medication and then the patient goes to the pharmacy and has to figure out what the medication cost is at that place. And so that's kind of a neat tool. It's been that HCPF has put a lot of effort into, and there's been pretty good adoption across the Medicaid network, which is pretty exciting. I'll also take this moment to share the results from our poll. Are you able to see it? Okay, great. So it looks like reducing patient out-of-pocket spending at the pharmacy was kind of our top answer here. And that is something that the prescriber tool can address for Medicaid members. But, you know, maybe there needs to be kind of additional legislation considered in this area to ensure that when people go to pick up their prescriptions, you know, the cost is not a surprise and that they can actually afford to take those prescriptions home.
Yeah, thanks, Rachel. That's interesting to see the results of the poll. And you mentioned also the proposal from HCPF to potentially eliminate those $3 copays for Medicaid enrollees as well. And so that's something else that would, you know, be a step in that direction, though certainly there's more room for improvement there. I'm noting also a question that I see from Sharon in the chat. I think it might just be visible to our panelists. About whether there are any policies from other states that are notable that have had a major impact on prescription drug costs. Rachel, I don't know if there are any of those that you came across in your research for the brief.
Yeah, that's a great question, Sharon. I'm not terribly familiar with what's happening in other states, but I do know that based on what we're doing here in Colorado, we really have become a leader in that area, especially with our efforts with the Prescription Drug Affordability Board. I know that the staff at the Division of Insurance are in communication with a lot of other states, and a lot of this is happening pretty collaboratively. And a lot of other states are really looking to, you know, what is happening with the implementation of our PDAB. And I think, you know, it's difficult to say exactly, but I think a lot of them are hoping to follow the example of Colorado with regards to our Prescription Drug Affordability Board.
Yeah, thanks, Rachel, and thanks, Sharon, for that question. I think we're often looking to what other states are doing, and it turns out that other states are looking to us a lot of the time. And I know I saw some friends from DOI on the call today, so they are certainly thinking about this a lot. I think we've got about 5 more minutes, so I'll ask a couple more questions. But again, anyone else feel free, or anyone else should feel free to jump in the chat or the Q&A. Emily, I'm going to jump back to you. So when you were talking about barriers to accessing childcare, you kind of highlighted 2 main reasons, but then you also had an other category. And I know that you put out a call for folks to chime in with their experiences there, but just wondering if you can say any more about what some of those other reasons might be, besides cost or closures during COVID, things like that.
Yeah, I was reading the responses that came through the chat, and a lot of them were related to provider availability. So just having enough spots in general to have the type of childcare that parents and guardians prefer, or that some prefer, putting their kiddos in more formal childcare settings. A lot were also related to wait lists, which I know a lot of people have experienced, and I came across this a lot in my research of the brief and just like anecdotally from folks in my own life of really long wait lists, like 9 months plus. So folks are having to get on wait lists to get childcare like before they're even pregnant, which is absurd. So wait lists definitely a big factor. And then a few other responses that we heard on the CHAS were related to parents or guardians that noted that their child requires specialty care due to various health conditions or disabilities. So there's also a piece of this that has to do with the type of care that parents and guardians need.
Thanks. That makes a lot of sense, and that helps kind of fill in what else might be behind some of those responses. Emily, maybe one more follow-up question for you. I was curious also, you had a graphic that showed a racial and ethnic breakdown for a couple of those top reasons. And I was curious about why you think it is that Hispanic or Latino parents or guardians were so much less likely to say that their childcare was closed during the pandemic or because of the pandemic. I know the pandemic, unfortunately, is not over.
Yeah, that's a good question, Ali. So I think it's a couple things that come to mind. One is, as Hispanic, Latino parents and guardians were so much more likely to report affordability as the top barrier, that there just were fewer reporting COVID-19 as a reason for not accessing childcare. But I also think that this sort of has to do with the type of care that parents or guardians might prefer. So families of color often tend to use family, friend, or neighbor, or FFN care. And that way they're able to find providers that are culturally similar to them, speak the same language. There are a lot of advantages to having childcare provided through that FFN family, friend, or neighbor network. So it could also speak to just the types of care that parents and guardians seek for their children based on some differences by ethnicity and preferences.
Thanks. That's super interesting and makes a lot of sense. I think I'll just ask, actually, I think given the time, I want to make sure that we don't keep everybody past 9 o'clock. I have so many more questions I can ask. I want to keep going with both Rachel and Emily, because I think these topics are super interesting. And I was fortunate to work a little bit with both of you on your briefs, but just keep thinking of more that I want to know on these topics. And I imagine the others on the call are feeling the same way today. So we'll go ahead and wrap up to ensure that we send you all on your way before 9 o'clock. Thank you so much for being here this morning to join us. Thanks, Rachel and Emily and Jeff, for sharing about your work with us. And as Rachel mentioned earlier, just want to highlight that our next monthly Eggheads is coming up April 20th about the super, super important topic of youth mental health. And so we hope to see all of you again there. Recordings are posted on our website. And so feel free to check there, share with a friend, or if you just want to watch this again, go to town. We support it. So thanks, everyone. Have a great morning, and we'll see you next month.
Thanks, everyone.